Hello and welcome to a brand new German New Medicine tutorial video. Today we will be talking about territorial marking conflicts. As always, the information contained in this presentation is intended for educational purposes only. It is not a substitute for professional medical advice. And here are the sources I used in the creation of this presentation. And let's get started. So I like to open these up with just the basic premise overview of German New Medicine. If you are brand new, I do suggest going back to watch GNM 101, which gives you all of the basics, but just the premise. All tissue changes. So anytime you have a symptom, a health issue in your body other than due to obvious injury, poisoning, medication effects, deficiency, are due to intentional biological adaptations controlled from your brain. These are ancient embedded biological programs, and the tissue adaptations are initiated by something experienced by the individual. We call a conflict shock. So some type of traumatic, upsetting event caught the individual off guard, and their body initiated this cascade of events, this biological special program, designed to help the organism out of the situation. And so we will see examples of this in today's conflict that we'll be discussing. So in GNM, we work backwards. We look at the symptoms the person is presenting with, and the symptoms tell a story of what conflict the person had. The symptoms also indicate whether you are in the conflict active phase or the healing phase. And we want to identify and become aware of the conflict source, of the context in which it arose, why you were sensitive to the situation, or what you can do in the future to notice sooner in the process, resolve conflicts more quickly, so you can prevent uncomfortable symptoms from arising again in the future. So for example, like we'll be talking about today, so burning urination. So if you've got what traditionally is called a urinary tract infection, that indicates to us that you experienced a territorial marking conflict that has been resolved and you are now in the healing phase. So with territorial marking conflicts, here are some of the health conditions that are a result of a territorial marking conflict. So I already mentioned a UTI, a kidney infection, bladder infection, bladder tenesmus. You can see all of the different things here on this list that can develop when you've had this type of conflict, or if you've had this recurring. So a lot of times, the symptoms can range, the diagnosis that you receive can range from pretty mild to more severe, depending on the intensity of the conflict, the duration of the conflict, and how often the conflict has been reactivated. So what is a territorial marking conflict? You maybe have a few guesses by now, but it's feeling intruded upon, feeling like your boundaries have been invaded. Competition, someone in your space, someone kind of telling you how to live or getting up in your business. It could have to do with feeling sexually violated, some form of abuse, jealousy in relationships, suspected betrayal. Is another cause of a territorial marking type conflict. Having to share, so young children, they will develop UTIs or experience bedwetting, this increased volume of the bladder, if they have to share their space or toys, if they have a new sibling in the house and all of a sudden they've got to share their parents and pretty much everything with them. If they're being bullied, if there's disrespectful treatment, can also cause a territorial marking conflict. Also, not knowing where your place is. Sometimes a territorial marking conflict can be similar to an identity type conflict, like not knowing, what's mine, where, what is my place, my space. And with all conflicts, it all depends on the perception of the individual. because every person is so unique in the way that they see the world. Just because a child has a younger sibling doesn't necessarily mean that they are going to experience a territorial marking conflict because of their presence, but some might. And so that's the wonderful thing about GNM, is it really takes the individual and their experience into account as being the most important thing. How did you see the situation? How did you experience it? And so there are also differences in male and female in the way that we experience biological conflict. So the more female type of marking conflict has to do with the inner boundaries, usually involving boundaries that occur within your physical or metaphorical space. And then male tends to be more along the outer perimeter, your outer boundaries, invasions in that way. And so this is just kind of little nuanced elements that tend to be different between males and females. Now let's go into the first biological law. So Dr. Hammer, he discovered the 5 biological laws, and so these are always at play in every significant biological program. And so the first one is the psyche-brain organ connection. So here we go. Psyche is where it all begins. This is where you perceive and experience a territorial marking conflict. This is your conflict shock. This is the DHS, the Dirkhammer syndrome, which the moment it occurs, there is an impact in a specific area of the brain. The area of the brain we'll be dealing with these conflicts is in the postsensory cortex in the temporal lobe. So there's an impact in that region, and then there is erosion of either the renal pelvis, the renal calyx, the ureters, bladder, or urethra. And so this is all taking place the moment that the conflict occurs. Next, we have the second biological law. And this law allows us to understand what's going on at each phase of this situation. So, we've got our normal just going along, everything's fine. Then the conflict happens. There are certain specific changes that occur. Then there's a resolution, and then the body goes through the reconstruction phase. So let's go through that for this type of conflict. So here we are, conflict active. This is when the shock occurs. So we've got this picture here of this guy making eyes at this other girl, and his girlfriend, or the girl he's hugging, very possibly could be experiencing a territorial marking conflict. So right now, the moment that happened, the body begins this process of erosion, tissue loss of the lining of the organ involved. So like I mentioned before, it could be any one of those areas. The amount of tissue lost depends on the intensity and duration of the conflict. And during this time, there's not going to be any major noticeable urinary symptoms. There may be an increased volume of urine during this time. May notice going to the bathroom a little more frequently. So on the psyche level, there's compulsive thinking. She can't get it out of her mind. She's up at night wondering about this conflict. And so that's a lot of times you'll notice you're not sleeping during conflict activity because your brain's trying to keep you awake so that you can resolve this conflict. We already mentioned that there's going to be an impact in the brain and the temporal lobe and the changes on the organ level. So why does the body do this? What is the biological purpose of this erosion? And the purpose is increased volume. So now we have more space for urine in the renal pelvis or the bladder, wider spaces for the urine to flow down the ureters and then out through the urethra. And so this greater volume is going to improve your ability to delineate your territory. And so in modern times, this isn't altogether relevant because we do not use urinating on things as a way of marking our territory. But it's biologically relevant because at some point in biological history, it was very important for organisms to be able to mark their territory in this way. And so that's one of the many amazing things about the knowledge of GNM is we take into account these biological programs that are programmed into our DNA. This is part of our biological history. And so now with our big brains where we can, talk about these things, we have to take into account the biological programs that are existing within our bodies so that we can work with them, with the knowledge of them, rather than just kind of going about not knowing that our body has these embedded programs. And so that's what's going on here. That is why the bladder's doing what it's doing. This is why the urethra is doing what it's doing. It's because we want to increase volume so that you can mark your territory in a more improved way. So we want to get to this point of conflict resolution where you've marked your territory sufficiently and now you're good. And there are many possible resolutions to any type of conflict, but particularly to a territorial marking conflict. So it could be some type of natural resolution. So you succeeded in establishing your space and your boundaries. Maybe you had to have a discussion with someone, a conversation. A lot of times having sex represents a marking of territory. So if, like we mentioned before, your territorial marking conflict had to do with jealousy, or your partner being, talking to other people or something, and then you finally come together with your partner, you have sex with them, you feel this sense of relief because you've marked your territory. And so that often can initiate a urinary tract infection or a bladder infection. Most women are aware of this. There's kind of like this, make sure this thing that women know about, that you should urinate after having sex. And the whole idea that we thought was that, when you urinate, it pushes bacteria down the urethra so it can't infect and cause an infection. But from the German New Medicine perspective, we kind of are seeing this in a different light now. It's more that you've marked your territory. You, before having intercourse, were feeling, like you needed to mark your territory. Now that that's happened, your body goes through the repair process, regardless of, bacteria being there or not. Other things that can happen, you can have an emotional release or forgiveness, develop a new perspective, understanding others. Your priorities may shift. Maybe you get a different job where Susie isn't getting up in your cubicle, seeing the bigger picture. And so conflict resolution is so important, and a lot of times it happens outside of our awareness. But if you are having reoccurring issues in this realm, if you get frequent bladder issues and infections, it would be worth looking at your perception if you are especially sensitive to boundary type conflicts. And this is actually what we cover in my online program called Resolve. My partner and I, we take these conflicts and we deconstruct them, and we teach lessons on what you can do. How can you have a conscious confrontation with someone? How can you, shift the way that you experience boundaries issues, or talk to someone if they need to stop crossing your boundaries? How do you have these conversations? And so we do have a brand new module that's out all about resolving territorial marking conflicts. I'll tell you a little more about that at the end. But if this is something where you're like, I don't even know, I'd love to resolve this, but there are people in my life, there are situations that seem unchangeable. If that's you, I have something that will definitely help you, so stick around till the end. So once you've resolved the conflict, you're in a state of relief. You have resolved this. Now your body sets to work repairing the tissue that was adapted during the time of conflict activity. And so before you were in a state of prolonged sympathetic activity, now the pendulum swings the other way to prolonged parasympathetic dominance. And this is where your tissues start to repair. So remember we said before you lost tissue, there was erosion. Now we need cellular proliferation. We need cellular restoration. And so that's what's happening here. And this is where you start having uncomfortable symptoms. Painful urination, that burning, horrible, stinging pain during urination, frequent urges to go to the bathroom but not being able, this incomplete emptying because the urethra is swollen. uncomfortable inflammation. I mean, I have experienced this, and it's one of the most awful things I physically have gone through. And so, so psychologically, you've relieved the problem. Your psyche is in a state of relief, but your physical body now is in the stage of restoration and reconstruction. On the brain level, there's going to be swelling in that brain region. So this may cause some dizziness, possible headaches. Some other things that can be going on, you can form uric acid stones if you are in a prolonged healing state. So what happens is up in the renal pelvis and the renal calyx area, if there's a lot of swelling there can become stagnation, and that can cause these stones to form, which eventually get pushed down the ureters, then down into the bladder, and eventually out through the urethra. So that's another painful complication that can occur. Now, the height of the healing phase. So once you've gone through the first half of healing, you get to the point of you're in this deep state of parasympathetic activity, and now it's time for your body to surge. A surge of sympathetic dominance occurs at this point where you experience intense pain and spasms, cramping, and chills. And during this time, this is like we mentioned before, that the uric acid stone may be pushed down. So this happens in every biological program. There is an epileptoid crisis. There is this surge which happens to squeeze out the edema that has been accumulating during the first half of healing. And so this a lot of times will happen during the nighttime when you are in a deep state of rest. On the brain level, you may have a headache or a severe dizzy spell. You may even faint. These post-sensory cortex biological conflicts, sometimes there'll be a drop in blood sugar as well. And so it'll be an uncomfortable experience that you go through, spasms, pain during this time. And then you move into the second phase of healing, PCLB. So this is called the scarification phase, where things start to subside. There's continuation of tissue restoration. During this time, bacteria may be present. So depending on the intensity and how much tissue was adapted during the conflict, bacteria are very useful helpers during this time to help with the reconstruction. On the brain level, we've got glial cell proliferation, the brain is healing, the tissues are healing, and we're getting back to normal restoration of function. So a lot of people are going to say, well, I thought it was the bacteria. I thought the bacteria, and this is what the idea that I always had in my mind was that the bacteria, crawls up the urethra and then it gets up into the system, again, related to sex a lot of times, or, lowered immune system is an idea that's out there about why these infections take place, was that the bacteria just gets up there and the immune system's low, or the microbiome is disrupted, or poor hygiene, and then the bacteria take over and you have an infection until you take an antibiotic and clear it out. And from the GNM perspective, the bacteria only become active during the healing phase, and they are there serving a functional purpose to help restore the tissue. And so, there are bacteria all over your body. They're there all the time. Why? They're sitting there dormant, waiting for the second half of healing to come around so that your body can restore tissue or break down tissue. Bacteria serve a functional purpose, which we will talk about in the fourth biological law. So an overview of the third biological law, this is the compass of GNM. This type of conflict that we talked about today, you can see this was a cerebral cortex type conflict, which meant that there's cell loss, ulceration during conflict activity, followed by tissue restoration with bacteria during the healing phase. This is detailed knowledge of the human body based on the area of the brain that controls the tissue, the embryological germ layers. This information is absolutely vital for people to understand so you can know how your body functions. You know how certain tissues do their thing and what to expect when you have certain biological conflicts. The fourth biological law, Diseases are not contagious. Bacteria and fungus, they are optimizers of the healing phase. They're seasonal workers. They're all over your body all of the time, but they work off of instructions from the brain. They become active when they are necessary. And so, this is a big picture, and I know it takes a lot for a lot of people to shift this paradigm because we are so used to thinking of bacteria as the bad guy and of overgrowth and of damaged immune systems and all of that. But this paradigm really does, it flips the script on what we thought about bacteria and how they function in the body. Now, the fifth biological law, this is just kind of a big picture that disease, as we think of it, it's not an error. It's not really disease. It's these biological programs, again, that are embedded in your body for the greatest benefit of the organism. Your body wants to survive. You are literally, every cell in your body is programmed for survival. And so your body is not making a mistake. It's not broken. It's not damaged. It's doing things based off of programming that most people aren't aware of. And so this is also, GNM is also called the sacred medicine because it really is. It's this really amazing innate wisdom in our body that Dr. Hammer decoded. All right, so thank you for watching this presentation. I hope you learned some things about your body. And if you are, like I mentioned back when we were talking about resolution, if you're interested in learning how to resolve biological conflicts, I have an online community called Resolve. And normally it's a monthly membership, but I just started releasing modules individually. So you can purchase the module that's just specifically about territorial marking conflicts. And if you use the code YouTube, you can get $5 off your purchase. This is the module, Resolving Territorial Marking Conflicts. We have an introduction, and we break it down into different categories. So people behaving badly, so people doing things violating your boundaries. What do you do about that? How can you have a conscious confrontation with these people so that you can speak your mind and establish these boundaries, perhaps maybe for the first time in your life? A lot of times early on in life, we develop these tendencies and these habits of not being able to speak up for ourselves and telling people when they're crossing a line. But then there's also your perception. If you're overly territorial, if you are noticing that people are doing just pretty much normal stuff, but you are extremely sensitive to normal interactions, what can you do to shift your perspective? And then there's just difficult situations, living with family, living with roommates, having multiple children in a small home. What do you do with these situations? How can you resolve territorial marking conflicts when there are some type of spatial limitations? And so we talk about all of that in this module. There's also a guided meditation, a note pack, and a workbook to help you work through these conflicts. So we're really excited about this module, really excited about you being able to purchase individual courses separate from the Resolve huge community where there's dozens of courses. And so if you have any questions, feel free to email me, drmelissasell@gmail.com, and I will see you again for another tutorial.